I'm here to talk to you all today about what happens when the immune system goes wrong. And this is such a topical talk, in the current climate of COVID that we've been enduring for the past 2 years. So the scope of today's talk is to share with you all a little bit about what is the immune system, and what can go wrong with the immune system, and the conditions that are caused by autoimmunity, using rheumatoid arthritis as an example, and what to do if you suspect that you may have a problem and how you can help yourself. So the human body is a fantastic organization of different systems and structures, all with different function, and it all works together, and all the different systems and structures work together to a common goal. That common goal being to keep the organism alive, to allow the organism to reproduce itself. And it's a little bit like, if you want to think about it, it's a little bit like a country, and the country is organized into different government ministries and organizations. And here are some examples of body systems. They do different things, like the musculoskeletal system allows the organism to respond to its environment. The nervous system directs information from the periphery out into the brain, and from the brain out into the peripheries. The circulatory system keeps us alive by bringing oxygen round, and food, and taking away waste product, and so on and so forth. So the immune system is special because it is the body's total defense system, and it has many components working all together. And you can think of it like our total defense system. Very, very many different agencies working together. And they work together in a way similar to how an orchestra would play. So if you have every function of the immune system, in fact, every function of every system in the human body is like, can be analogous to a very, very complicated orchestral score, like what you can see on the screen. Many, many different people, all doing their own part, but all acting together, all very important. When everything works well, you get fantastic music. So the same is true of our immune system. When everything all the body systems, when everything is in balance and working well, you get a healthy individual. So from the time that we are born to the time that we pass away, the immune system is constantly at work, and it's interacting with our environment, and it's like a country's defense system. It's got many levels, and it's constantly maintaining a balance. What's the balance? It's reacting towards invaders, and it's tolerating environmental things that are not harmful to you. So a healthy immune system can tell the difference between me, who is friendly, and who is the enemy. It also knows when to raise the alarm to activate. It can rally the troops, produce ammunition to isolate. It also knows when to stand down, and it can activate the body's repair functions to repair the damaged war zone. So we have natural barriers for defense that are not always thought of as part of the immune system, but actually act to protect the human body. So for example, your skin and all the surfaces, like the surfaces within your mouth, your eyes, all these surfaces contain rapidly growing cells. And these cells are very hardy. So, every time I brush my skin like that, there will be a layer of dead skin cells that will fly off and float. And then another layer is being produced to replace that layer. And when you don't have this process that happens fast enough, for example, in your mouth, you might get an ulcer, for instance. So there are rapidly growing cells that replace the ones that are dead and dying. All your orifices produce mucus to trap germs and wax to trap germs. There are enzymes on the surface, like in your mouth, to digest those germs. You've got stomach acid and digestive juices, also to kill germs. And there is also a system to wash away the dead debris. So tears, the little hairs that line your airway, that push out the mucus, and urine, these are all flushing systems to wash all the germs away. So what happens when the defense system is breached? Well, the immune system has components that respond in the early phase and those that respond later. So you can think of them as being first responders and then those that come a little bit later. So if you have a breach in the skin, so for example, you cut yourself, then the body will isolate the area to minimize the breach, send in the troops to neutralize the invaders, clear up the dead and dying, and then repair any collateral damage. So one of the first responders is this guy here, the little neutrophil, which is a type of white blood cell, and they are present in your body in large numbers. They are short-lived and they are willing to die to protect you. So they will engulf the germs, and this blue stuff that you see inside the cell are full of they have this sort of stuff inside. It's got toxic granules, and these toxic granules can be released to fight the germs, and it can also engulf the germs, and then many of it is on like suicide mission, so it will go and then it'll engulf and then it'll die and form pus. So this is an early phase of defense. The next level of defense happens a few days later or a little bit later, and it consists of ramping up of cells with specific capabilities to kill germs. And this may be production of antibodies. Also, antibodies may be produced also that will help to have a neutralizing capability on the cells, neutralizing capability on viruses and bacteria. So this next level of defense is, you can think of it as being like the intelligence level, and it is there so that once you have met that particular germ before, the next time you meet it, the body has the ability to recognize it quickly and quickly ramp up the neutralizing capability. So what happens when a virus invades? I get asked this question all the time because, with COVID and things, everyone is very interested on how viruses work and what it does. So this is, I think, from the Britannica. And viruses are actually very interesting things. They're amazing because they're just packets of genetic material that rely on hosts for its survival, and they replicate. So when a virus infects a host cell, it invades the cell in order to survive and replicate. Yeah. So here you can see it enters the cell, and then after that, it strips out the outer surface and then lets its genetic material be released. The genetic material is then incorporated into the cell's manufacturing system, and you make more of itself. So this is like zombie apocalypse. You get bitten by a zombie, you turn into a zombie yourself, and it is exactly what happens in viruses. So the cell then becomes a virus factory, and it makes lots and lots and lots of these viruses, and then it bursts and lets out all these little viruses, and then these little viruses go on to the next one and the next one and the next one, and often the cell is destroyed. The cell itself is destroyed in the process because as the viruses are released, the cell is no longer useful. The cell breaks down and dies, and it repeats again and again and again. So how does our immune system recognize cells that have been infected by viruses? Well, each of our cells makes proteins, and it displays these proteins to the outside of the surface of the cell to tell the surveilling immune cells what I am making. So it's a little bit like, when you go to some of those Japanese restaurants and they have those plates of food outside, it tells you these are the kind of food that is served here in this restaurant. So the same is true of the cell. It is there and it is putting out pieces of the kinds of proteins that it's making. So and then the surveillance T cells that go by will survey the kinds of fragments of proteins that this particular cell is making. So then if it detects that, hey, you are making something abnormal, it will then activate a kill code and kill that virus-infected cell. Okay, so that is how, in a nutshell, it works. Have a look at this particular website. It's from the British Society of Immunology, and it is bite-sized information on how does the body's immune system respond to viruses and bacteria and things like that. So this is a very, very superficial scratching of the surface just to explain to you, because this concept will become important later on. So this is one way in which a virally infected cell can be killed, or how viruses can be neutralized by our immune system. Another way is by making antibodies, and antibodies are like magic bullets. They are specific proteins that stick to and neutralize certain targets. So it will neutralize its target and prevent it from acting. Once it's stuck onto it, it will then encourage other immune cells to come and eat up this bit with all the sticky bits stuck onto it. In the case of the vaccines that we've been having for COVID-19, the Pfizer and Moderna vaccines are spike protein vaccines. So it is a vaccine against this particular part, these horrible things out here called spike proteins. And this spike protein is used as a key to enter your cell. So it'll bind to your cell, and then it's like a key. It'll open the door and then merge itself with your cell and spit all its genetic material inside. Its genetic material will bind itself with your cell's production machinery, which will then make many more of these little critters, okay? So what happens with the neutralizing antibodies that we hope to have is that it will stop that binding and stop the antibody, to stop the virus from going into your cell. So, so that's very important, but also equally important, as I said earlier on, is the notion that once the war is over, you need to stand down and you need to repair and rebuild, as well as dispose of dead cells. So the immune system has special cells and signals that will allow that to happen. So how does the immune system know which is me, which is friendly, and which is the enemy? Well, because many of the first responders, like the neutrophils and things, they've already evolved in concurrence with bacteria over millions of years, and we've evolved together with pre-programming. And so these first responders already recognize certain dangerous bacterial patterns. When they detect these, they are pre-programmed to start a cascade that will allow that bacterial pattern to be neutralized. And then the rest is learned from as early as the time that we are in the womb. So from the time a baby is born and it comes through the mother's vagina, in a vaginal delivery, it will meet many kinds of bacteria. And those many kinds of bacteria will begin a process of education of the immune system to what is friendly, what is not, and then it will learn to tolerate those that are not harmful and attack those that are. So we humans have actually capitalized on this education system. And we've capitalized on the immune system, educating the immune system in the form of vaccines. So what vaccines do is that it educates the immune system about particular viruses or bacteria by introducing either killed parts or parts of it to allow it to develop the capability to recognize and defend it the next time it meets it. So one way of thinking of this is like saying, okay, in the military, we go for exercises. We go for joint exercises with different countries, or we have reservists. Why? Because you are continually wanting to refresh and develop capabilities to recognize and defend the next time you meet a threat. So the history of vaccination is actually fascinating. One very fantastic illness that was eradicated with vaccines is smallpox. So smallpox or variola is an illness that causes these little vesicles, like liquid-filled blisters that occur mainly over the face, and it's very, very disfiguring, but also over the body, and can cause scarring and blindness and death in 3 out of 10 people that were affected. So, you would read, or I have read books, set in the 17th and 18th century, where the heroine was scarred forever because of smallpox, and or died because of smallpox and influenza and conditions like that. So, from very, very early on, people had noticed that in people who caught smallpox before and survived, they didn't get it again. And in China, in the Ming Dynasty, this was what was done. Physicians got scabs from recovered mild cases of smallpox, and they collected these scabs and they left them to dry. Then they powdered it and blew it up the nostrils of children. And it was said that you must not get the severe cases, and you must leave the scabs to dry. Why? Because you want to introduce, and all this is very fantastic because it is you get the mild cases, so that there is probably less viral load. You leave it to dry so that the viral load probably becomes even lesser, and then you powder it and in small quantities blow it up the nostrils of children. But even in this kind of in this kind of method, they discovered that people would get a mild version of smallpox and then be protected against severe ones. But this was risky because there were also cases of those who were affected severely and died from it. So clearly a better method was needed. And Edward Jenner in 1796, he noticed that milkmaids who were milking cows by hand would often catch a condition called cowpox if the cow that they were milking had this illness called cowpox. So they would get blisters on their hands. But if they caught cowpox, they wouldn't get smallpox when there was a smallpox outbreak. So what happened was, when one of the milkmaids he noticed had cowpox, Jenner took the pus from the milkmaid's blister and grabbed his gardener's son, who was 5 years old, and jabbed him with the pus and waited to see what happened. And then the next time a smallpox outbreak came, Jenner then exposed the gardener's son to the smallpox, and lo and behold, he didn't fall sick. Now, this experiment was done in 1796. These days, no ethics board on earth would allow this to happen, but that's how progress was made, and that was the start of vaccinations. So vaccine strategies since then can be divided into 4 broad kinds. Either you weaken the virus, so you weaken the virus so that it reproduces poorly inside the body. One example of this is the chickenpox vaccine. So it is weakened, but there are people who have had the chickenpox vaccine that have come up with pox as well. Okay, it can be inactivated or killed virus, like influenza virus, for example. That is a killed vaccine. You can use part of the virus. So part of a virus or part of a bacteria is used. For example, hepatitis B, you use a particular subunit as the vaccine. You can look at poisons or toxins that the virus makes and inactivate those. For example, tetanus is done this way, or whooping cough is also a toxoid inactivated toxin vaccine. And then, or you can use part of the genetic code. So, for example, you can take the virus's genetic code and put it inside another virus that is inactivated and inject it inside the person. So an example for this is the AstraZeneca Oxford vaccine for COVID. And you can use the mRNA which is the blueprint for making a particular part of the protein of the virus. And this example is our Pfizer and Moderna vaccines. DNA vaccines are not available yet. So the last category here, that's not available in clinical use yet. So in Singapore, our national childhood immunization schedule is like this. So there are 12 conditions where there are vaccines available and recommended. So the COVID vaccine strategies I've alluded to earlier on are these sorts of strategies, and all of them serve to try to allow the cell to be the cells of our immune system to be educated and better prepared. It's a little bit like saying, okay, our kids are going for exam, maybe the O levels, maybe PSLE. You want to do some trial exam papers first, and you want to have a mock or a prelim before you fight the real thing. And that's what it's all about. So let's now talk about malfunctions. So as with any system, the body can malfunction. Like your home, there are things in your home that can malfunction, and so the same is true of the body. And how the immune system can malfunction can be very simplistically thought of in perhaps three ways. The first is that you are deficient. You are not working up to the level that you are supposed to be working. The second is an overactive immune system. So you are overperforming, and we'll see why that's not good in a minute as well. And the third is that you're confused. You no longer understand which is me and which is the enemy. And that is an example of autoimmunity is one such example of an immune system that fails to recognize itself. So a deficient immune system is a little bit like having this table here, right? That's got a big hole in it. And, it may do some of what it's supposed to do, but for bigger things, it can't. So immune deficiency, you may be born with it, or you may acquire it in later life. And we know that there is a phenomenon called immune senescence, which means aging of the immune system that happens, in the same way that any other part of your body ages. Like how your joints will age, your hair will turn white, your skin starts to sag, and so the immune system also starts to become deficient. Certain illnesses can make your body's immune system deficient as well. For example, the human immunodeficiency virus, HIV, attacks a particular component of the immune system and makes that component deficient, and therefore makes the people it infects vulnerable to germs that wouldn't otherwise affect healthy people. So how can a deficient immune system be deficient? Well, you may have a problem with the cells that makes it up. So for example, you don't have enough white cells, your immune system might be deficient. If your cells are malfunctioning and they're not doing their job, that will also can cause deficiency. If you are not able to make enough antibody, or you are not able to make antibody in the appropriate way, it can be deficient. If your different parts of your immune system are not talking to one another properly and signaling to one another properly, then you may be deficient. So it's like saying that, I am not passing the message on to somebody else equally. So there is no coordinated effort to fight against the enemy, as it were. And all of this deficiency will usually lead to illness, or they tend to be discovered only if they lead to illness in the host. When your immune system is imbalanced, that also can cause a problem. And in certain situations, the immune system may become overactivated or overstimulated, and you don't know how to stand down. it's a little bit like a 3-year-old having a tantrum. When they start, right, if you don't quickly distract them and calm them down, they then get into this crying fit. And, a lot of like once they get into that crying fit, there's a lot of collateral damage. And, it takes ages before things can calm down. So it's exactly like that. And COVID-19 is even more interesting because it can, one of the reasons why COVID-19 is so feared amongst doctors as well as health people in the line of healthcare is because of what it can do. It is a really, really sneaky virus. It's sneaky in ways that you cannot imagine. So what it does is that when it infects your cell, it buys itself time. So remember how I said to you earlier on about how different cells will exhibit what they are making inside to allow circulating immune cells to patrol and see and make sure that everything is on board. So when the SARS-CoV virus enters your cell, it can no longer be seen from outside. And what it does is it stops the display. So, you carry on displaying all the things that you are supposed to display, but you don't display bits of the SARS-CoV-2. So in this way, it can it can evade detection, and then it will make your cell's mechanism make a lot of itself, and then go on and come out and infect the next cell, and the same thing happens. And it's a while before your immune system actually tweaks that, hey, something's going on, okay? But by then, it's affected a lot of cells. So what it does is slightly different in the child, the adult, and the elderly. And the reason why it's different has got to do with the body's immune systems and how it responds, and also the phenomenon that as we age, certain aspects of our immune system don't work as well. So in children, there are what we call cross-neutralizing antibodies. So antibodies that act against very, very many different viruses and different strains of coronavirus. There are also fewer receptors that will allow the viruses to enter the cell. The child's immune system also produces more chemicals that calms down the immune system quicker. This ability to calm down the immune system a little bit quicker gets lesser the older you get. The other thing that happens the older you get is that you have more of the proteins on the surfaces that allow the virus to enter. And there are also fewer cross-neutralizing antibodies. So what happens is that you get more and more infected, more and more infected, more and more infected, until finally, when the immune system tweaks that there's something going on, it goes berserk. And this is not unique to SARS-CoV-2 or COVID-19, okay? It can be present in a lot of other illnesses as well. It can be triggered off by other bacteria. It can be triggered off by other viruses. It can be triggered off by a whole load of things, okay? So when this happens, the body produces a lot of chemical messengers that recruits many immune cells. So it's like saying, I have just turned on the island-wide alarm system. Okay, I turn on the island-wide alarm system because there is a burglar in my house, and I'm going to take and use a nuclear bomb to bomb my house because there is a burglar in my house and I want you all to know it. Okay, so I will turn on as much of the emergency alarm system as I can and call everybody to do their thing. The trouble is when everyone starts, so I will get the Air Force to fire their missiles at my house. Okay, what then happens is all the houses by the side get destroyed. When the houses by the side get destroyed, everybody starts to panic. When when all the cells start to be triggered, more inflammation starts to form, and there is this phenomenon called a cytokine storm that will happen, and it's literally like a tornado. Okay, lots and lots and lots of inflammatory chemicals get produced, and more inflammation happens, causing inflammation in the heart, widespread clotting within your blood vessels, which is not supposed to happen, inflammation in the liver, leaking in the lungs, inflammation in the kidney, affecting your blood cells, and eventually what happens is that you get damage and organ failure. So that is an example of an overactive immune system. Okay, now we move on to autoimmunity, which is the confused immune system. In some people, the immune system may not be able to differentiate between self and the enemy, and so it becomes defective and starts to attack normal components of your body. So it may happen in many different ways, and one way would be when there is production of large amounts of antibodies against components of your own body, leading to its damage. And this damage is called autoimmunity. So it's essentially a civil war. An autoimmune illness may affect one single area of the body, or it may affect many different areas. And it may affect, so this is an example of the spectrum of autoimmune illness. Many of you would have heard of thyroid problems, thyroid disease. Some of you may be taking medicines for thyroid disease. When you have either an underactive or an overactive thyroid, it is because your immune system has gone a little bit haywire and is attacking the thyroid, or one of the reasons can be, and then, but it's only attacking the thyroid and nowhere else. But at the other end of the spectrum is an illness called systemic lupus erythematosus, which may affect any part of the body because the antibody responsible attacks components of your nucleus, the center of the cell. So when you have an illness like that, it can affect any body system. And that is what leads to multi-system autoimmunity. Autoimmune illness is actually not common. And, you know, rheumatoid arthritis affects 1 in 100 people. Lupus affects 3 to 5 per 10,000. You contrast this with diabetes affecting 1 in 9, high cholesterol affecting 1 in 3, and high blood pressure affecting 1 in 5. So, you know, autoimmune illness is not common. And there's not one single cause for it either. It is a complex interplay between genes and environmental factors and the immune system. There isn't a single autoimmune gene either. Most autoimmune illnesses don't fit into a simple pattern of inheritance. When I say simple pattern of inheritance, it's like inheriting your blood type A, B, or O, or AB. It's not as simple as that. Okay, there may be multiple genes, all giving you a tiny contribution. And having a parent or a sibling with autoimmune illness doesn't mean that automatically you will get one yourself or that you will have the same illness. But you would be at a higher risk, that's for sure. The environment will deliver triggers if you are somebody with the genes that make you more susceptible, and that may lead to changes in your immune system. And then over a long period of time, more and more triggers accumulate. The immune system starts to malfunction and then causes damage, and the damage will be shown as symptoms, which we recognize as disease. So it's very hard to study environmental triggers because autoimmune illness is not common, and so there are few subjects to study, and there are thousands of possible environmental factors, and each of these thousands only confers a very small risk, and it's likely that these different factors will affect different people differently. And also, autoimmune illness is very variable in its course. Some people have it very young, some people have it only in later life. So it's very hard to determine the exact impact from the environment and the exact impact for each individual. But of course, there are environmental factors that have been well recognized to have more of a role than others. Pollutants, especially cigarette smoke, is a big one. Smokers have twice the chance of developing rheumatoid arthritis compared to non-smokers, for example. And if you are a smoker with rheumatoid arthritis, you would be very likely to have an aggressive form, needing a lot more medications because the medications seem to be much less effective in you. So other environmental factors that have been implicated will be things like infections and then stress and then diet and gut bacteria in certain kinds of immune illnesses seem to be playing a role. The exact contribution and the exact degree of contribution is not really well known. So the example that I've chosen of an autoimmune illness is autoimmune arthritis, because I'm a rheumatologist and this is what I deal with day to day. So an example of an autoimmune arthritis is rheumatoid arthritis. And the immune system attacks the joints and other parts of the body and causes damage there. So many people think of arthritis as being something that affects the elderly. That is wear and tear of the body, and that is not rheumatoid arthritis. That is wear and tear of the body because of age. Is osteoarthritis, and is a very, very different condition. Rheumatoid arthritis affects anyone from literally as young as 9 months old, which was the one that I'd seen before, to very elderly. My oldest patient is in her 90s, and it averages out to be about 1 in every 100 people worldwide. So it doesn't cause wear and tear like this here. What it is that the immune system and immune cells invade the lining, causing the lining to become thickened, and then it starts to wear out the bone and wear out the joint, and it causes swelling and pain and stiffness. And the stiffness and pain lasts for several hours. And unlike wear and tear, which gets worse when you spend a long day on your feet, this kind gets better when you move around and worse when you rest. And then the joint affected feels spongy and warm, and it can be quite painful, and the pain is particularly bad at night. So how your doctor would make a diagnosis would be by asking you about your symptoms and examining you to see what the joints look like and doing supporting tests like blood tests and x-rays or scans. And why it happens is thought to be, again, an interplay between the genes that you've inherited and environmental factors. So the genes will there is a lot of information about genetics of rheumatoid arthritis, particularly coming from Northern Europe. About 50% of the genetic load actually remains unknown. But genes are not the only thing that matter. So if you have a pair of identical twins with 100% identical genes, only 15% of those cases of identical twins will have both twins having rheumatoid arthritis. Okay, it means that the other 85%, only one of the twins gets it, and the other doesn't. So even if you have 100% identical genes, only 15% will end up with both. And then if you have fraternal twins, which are essentially like brother and sister, or siblings that are siblings, then only 4% of cases will have both siblings having rheumatoid arthritis. So if you are a first degree relative of somebody with rheumatoid arthritis, you have about 3 times higher risk of developing it compared to if nobody in your family has it. And as I said before, as for all other autoimmune illnesses, smoking seems to be a big risk factor. Gum disease, poor dental hygiene has been shown to be a trigger factor as well in individuals who have susceptibility genes. Certain infections may be triggers. It's thought obesity is now being blamed for a lot of things, and we've found that obesity is a risk factor for so many things, including speeding up wear and tear of the joints, increasing your risk of cancer, and also making you have an immune system that is more likely to malfunction. Because fat cells are not just storage cells, they are also responsible for production of a whole load of chemicals that affects the immune system. And rheumatoid arthritis doesn't happen overnight. You as a patient may notice your symptoms develop in quite a short period of time, but in fact, the process that has been leading on to it has been occurring over years. So for somebody born with the genetic susceptibility, it may be years. They've had like various infections, and then after that, may have had poor dental hygiene, and then smoker, and multiple environmental things added together before you actually develop the first onset of persistent joint pains. So in a way of thinking of this is a little bit like saying the genes that I inherit are like this house that if my body is a house, the genes I inherit are how many percent of my house is concrete, how many percent of my house is wood, how many percent of my house is straw, and so on and so forth. And then the environmental factors are what I do to the inside of the house. So, if I leave piles of rubbish outside, if I smoke, and, then my house might be set alight. When the house starts catching alight, this is what happens in the joints of a patient with rheumatoid arthritis. The joints become swollen and stiff and uncomfortable, and the patient may have trouble making a fist. So as with fire, if you and with every autoimmune illness, if you do nothing about the fire, what will happen is that the fire will burn the house down. And so if you do nothing about putting out the fire, then eventually the inflammation in the joints will destroy the joints, and then the joints will become deformed. So rheumatoid arthritis is a chronic illness, and as with all autoimmune illnesses, there is no cure. Once the disease process has been set in motion, I explain this to my patients by telling them that it's a little bit like frying an egg. Once the fire is turned on, what I can do is I can turn down the fire to really small or turn off the fire, and that is what we are left with. Okay, we cannot make it's like Humpty Dumpty. Also, you can't go back into the unbroken egg. Okay, so once the process has been set in motion, it will change, and the changes that have occurred up to that point are many of them are irreversible, but you want to prevent further changes from happening. So if rheumatoid arthritis patients are treated early, the disease is easier to control, the damage is less, and the function in the long term is preserved. Their overall health will be better, and the total amount of medications they may need in the long term is lesser. And there is, in fact, even a possibility of a disease that has quieted down off medications. So the strategies that any rheumatologist will employ would always be to keep the fire as small as possible, and to increase medications until the patient has no more painful or stiff or swollen joints. So there are other problems that can crop up. If you have one autoimmune illness, you may develop other autoimmune illnesses with time, or other areas of your body can be attacked as time passes, because the body is not a static thing. Some people ask me and said, I never had this last time. Well, yes, because, there wasn't coronavirus before 2019, or SARS-CoV-2 before 2019. So, things change all the time, and other problems may crop up, new problems may crop up, and other areas of your body can be attacked by the immune system and become inflamed as well, like the lungs, the eyes, the nerves. And, if you have rheumatoid arthritis, your risk of developing certain other kinds of conditions are also increased because of the illness itself. For example, patients with certain types of immune illnesses like rheumatoid arthritis and lupus have a 2 times higher risk of heart disease compared to those without, of the same age. And this is because of the disease itself. So medicines for immune illnesses, as particularly autoimmune illnesses, would aim to extinguish or to control the fire to minimize damage. In the case of rheumatoid arthritis, we are trying to minimize damage to the joints, and there are many different kinds of medications, and your doctor will discuss with you which is the best one depending on your own individual circumstances. There are many different treatments that can be used to dampen down a confused immune system. The thing that I have to add is that um, uh, autoimmunity happens not because the immune system is weak. Many people have this misconception. The immune system is not weak, it's confused, it misrecognizes. It has all the things that it needs to do damage, but it doesn't know who is me and who is the enemy anymore. And therefore, if you have an autoimmune illness and you take a medicine to boost the immune system, you may boost the wrong bit, and then everything will go out of control. At the moment, we use medications to lower the immune response, to turn down the fire, to turn down the fuel to the fire, to stop it from damaging the body. There are as yet no magic bullets to turn off the fire. When you turn down the fire, you have to balance, and the balance is between making sure that you do not suppress the immune system too much, because the patient will be vulnerable to all kinds of infection. And if you suppress the immune system too little, then the immune system will carry on damaging whichever bit that it was attacking before. The effectiveness of medications depends on a lot on the individual and on how long the fire has been burning for. Large-scale studies for rheumatoid arthritis alone show that many patients will only need one kind of medication, but a proportion will need two or more, and some may need very expensive medications, especially if the fire is burning very fiercely. So the size of the fire extinguisher that you use is commensurate with the size of the fire that you are fighting and the kind of fire that you're fighting. There are, of course, unwanted effects of medications, and there may be specific intolerances specific to the patient that is taking the medicine, like nausea or rashes, and sometimes some of them may be due to effects of certain medications taken in the long term. So for example, if you were taking steroids for a very long time, it can cause thinning of the bones and weight gain. And steroids were in fact discovered around the time of the World War by a rheumatologist who had worked on it together with, and the story is quite a fantastic one, and it talks about about how steroids transform the lives of patients who previously had no choice but to endure pain, and as the illness ate away at their bones and ate away at their joints. So steroids get a very bad press when they are taken at high doses for a very long period of time. They do have a lot of unwanted effects, but equally there are a lot of benefits, and they can be life-saving in patients, especially those where the fire is burning out of control. What can you do if you or somebody you know has an immune illness like rheumatoid arthritis, for example? I chose this because it is one of the commonest immune illnesses that I treat. And so the first thing is see a doctor. See a doctor and get yourself seen by a rheumatologist as quickly as you can, because the key is catching the disease when the fire is small. So if you come to me when the fire is small, I only need to use a small fire extinguisher. If you come to me when the fire is engulfing your house, I have to use a fire engine with many, many fire hoses. And when I have to use a fire engine with many, many fire hoses, there will be a lot of collateral effects as well, okay? So all the government restructured hospitals have rheumatologists, And there are also a lot of rheumatologists in the private sector, and the polyclinic doctors and GPs are aware of the workflow of how to get patients to see the rheumatologist. So no worries there. Okay, you unlike many other countries where there are very few rheumatologists, in Singapore we are fortunate. And there are good quality websites with peer-reviewed articles. Guard yourself against fake news and hearsay. Educate yourself and the people around you. Learn about the disease, available treatments, and how to help yourself. There is, in Singapore, we have the National Arthritis Foundation that also raises awareness and raises funds for patients that may need high-cost drugs that are unable to afford it otherwise. And in the UK, there's the National Rheumatoid Arthritis Society. This is the website that you can go and have a little look at. No matter what condition that you have, be it an autoimmune condition or not, I think that you can do the best by yourself if you are an active partner in the management of your condition. The health care professionals that look after you, be it for arthritis or any other illness, actually want you to get better. But what we can do is actually very limited if patients don't take their medications, if they continue to smoke, and if they don't make efforts to change their diet or their lifestyle. So these are lifestyle aspects that can play a part in these conditions. Rest. There's a lot to be said about getting enough rest and stress management and smoking and exercise and diet and dental health and so on and so forth. So, as an individual, all these things are really fairly basic. We say it's basic, but many people find that it is too hard to do this, and it's easier to take a pill. So when people come to my clinic, the first thing I say to them is that you need to look at there is a basis on which we build health, and the 4 legs to it is sleep, food, stress management, and exercise. And then if you are able to manage all of this adequately, on the top of that will be medications and whatever other things for the management of your condition. But it's these four basic things that a lot of us struggle to manage. Okay, so do everybody go and have a look at your lifestyle and see what aspects of your lifestyle can be adjusted to so if you're not getting enough sleep, you should be trying to get enough sleep. If you're smoking, you should try and stop smoking, and so on and so forth. Stress is strains our biological or psychological capability. Now, it's impossible to have a life without stress, but there is a complex relationship between stress and illness, and the chance of a stressful event causing illness varies between individuals. I have seen many patients come to the clinic either developing symptoms after a bereavement or divorce or some very stressful event. And the chance of this causing illness varies between individuals. So there are many variables that come into play, but we know that stress changes the level of hormones and chemicals in the body, and this may be associated with disease. Smokers, as I've mentioned earlier on, have twice the risk of developing rheumatoid arthritis compared to non-smokers. And rheumatoid arthritis uniquely is associated with gum disease. And it's because one of the bacteria that causes gum disease causes changes in the gum area and incites the immune system and causes problems elsewhere. So if you have poor oral health, there is an increased chance that you will have worse arthritis compared to somebody who manages the oral hygiene effectively. Weight management and sugar consumption, I alluded to earlier on. Obese patients have more difficult to control arthritis because body fat produces chemicals that drive inflammation. The other really interesting thing is that sugar is now the big no-no because consumption of sugar-sweetened drinks and high fructose sweetened drinks has been shown overseas in the UK and US to be associated with development of inflammatory arthritis. Even if you are not worried about the development of inflammatory arthritis, you should be worried about the development of fatty liver, which then leads to liver problems because of sugar sweetened drinks. And I caution my patients and my trainees about drinking bubble tea and Thai milk tea and all the sorts of various sweetened drinks because in our local culture, it is not the thing to really be drinking Coca-Cola. I don't find many people drinking Coca-Cola, but I see a very, very long line outside many of the bubble tea shops. These and those little bubbles are also containing sugar. For our part of the country, our part of the world, this is the area that we need to pay attention to. There has been shown to be perhaps some benefit for diets rich in green leafy vegetables and nuts and berries and fruit, and low in salt and limited red meat and high in oily fish and good oils, which is essentially a Mediterranean diet that has been suggested to be able to reduce the level of inflammatory chemicals in the body. So many of you may already know this, but there is a healthy eating plate, and the people are encouraged to take a lot of whole grain because the fiber in whole grain and vegetables actually feeds good gut bacteria. So you have friendly bacteria that live in your intestines, and those friendly bacteria, their food is fiber and their food is vegetables. And if you are just popping your probiotic pill and hoping that those friendly bacteria will grow well, they won't grow if there's no food, right? So if you don't eat enough leafy green vegetables and you don't eat enough whole grain, the good gut bacteria not growing is a little bit like taking flower seeds and throwing it on concrete and saying, hey, why I got no flowers? How come it's not growing? It's because you haven't provided the environment for the good gut bacteria to grow. So so do have a look at what you are eating as well. Do be wise with complementary and alternative therapy. So complementary therapy is treatments that can be used alongside your conventional medications to help you feel better and to cope better with illness. So for example, for pain control in arthritis, acupressure or acupuncture can be useful. Alternative therapy is therapy that is used instead of conventional medications. There are conventional medications have been through rigorous testing and it has to go through rigorous testing by law in order to prove that it works. But many alternative therapies haven't had this kind of rigor, and there's no scientific evidence that they may work. So some alternative therapies may not also be completely safe and can cause harmful effects. So please do tell your doctor if you intend to take anything other than your prescribed medication. Some traditional herbal medications have been shown to have properties that can help reduce inflammation and joint damage. But currently, there may be problems with the source, its evidence-based or quality control and dosing limits, which limits its use in the mainstream. So there are some examples, turmeric is one example, and there may be side effects and interactions between traditional herbal medications and other prescribed medicines. So I have had patients take turmeric supplements that come and have abnormal liver function tests as a result of the turmeric supplement, even though it is natural. So I would say that do be careful of what you are told. If you are told that a herb or a complementary therapy or an alternative therapy has no side effects, then it is really unlikely to have any beneficial effect either. Now, I say this again and again, which is that having no bad effects and only good effects actually goes against the law of nature. If you think about water, right? Too little water and you have drought. Or if you drink too little water, you'll be dehydrated. And if you drink too much water, you have water toxicity or you have a flood. And so water is neither good nor bad. There's no such thing as good or bad. It's all about the quantity and about balance. So there's no bad if you say that something only has bad effects and not and no good effects, or only good effects and no bad effects. That goes against the law of nature. Okay. And there are many places that have used words that appeal to our emotions. So many places that market over-the-counter remedies will use words that appeal to our emotions, like all natural, or organically harvested, and handmade, and such. Yeah. So it all natural doesn't mean all good. Okay, so there are lots of things that are natural. Tobacco is natural. Poisons like lead is also natural. It's found in the earth. Yeah. Be careful not to be taken in by words that sound good. Try and see beyond the words and see what the substance is. So the other thing to say about complementary medications is that if the medication has a biological effect, it has to either come out from the body through either the liver or the kidney. And so if you say, oh, I will take my medication 2 hours away from my Western pills, which is what a lot of my patients who take TCM tell me, that only stops it from mixing inside your stomach, but it doesn't do anything about it coming out from your liver, because there are some medications, Western medicines, that last in your body for 24 hours, 48 hours. I have medicines that last for 3 weeks. Just taking it 2 hours away from your Western pills is no guarantee that there won't be any drug interaction. So just be cognizant of that. Yeah. So do be careful of unregulated powders and capsules that are bought over the internet from neighboring countries, because they may contain banned substances that can affect the liver and kidney and cause severe allergies. Always inform your doctor what complementary herbs you are taking because of the risk of interactions. I've put this picture up here, not because it's an unregulated powder, but because it seems to be very in vogue now. For those of you who don't know, this is Lianhua Qingwen, which is a capsule that has been touted to have be good for use in COVID-19. As in symptomatically, it does seem to reduce some of the symptoms that you get from COVID-19. But one of the components of Lianhua Qingwen is this herb up here, which is ma huang. Ma huang is ephedra. Ephedra can cause very dangerously high blood pressure and abnormal pulse in patients, and we have certainly seen it in patients who have been admitted to hospital recently. So do be aware that even if your friend tells you that, hey, take this, it will shorten your symptoms or whatever, you must always be aware that for it to have a biological effect, it may have also an undesirable effect in you. There's nothing that can be 100% good or 100% bad. Yeah. And even if it doesn't affect the other person, it might affect you. So do go in with whatever you do go in with your eyes wide open. Okay. All kinds of horror stories of people who take green tea capsules and have liver failure. This one was local. It was a patient that we picked up where he was taking a traditional medication for, I can't remember what the condition was. I think it was gout or something like that. And then actually the medications contain a banned painkiller and a very, very high dose of steroids. And also there are other kinds of herbs. If we are not really aware of its possible effects, there are traditional Chinese herbs that can affect the liver as well. Okay, and more is not always good. Okay, so I guess my takeaway messages to everybody is that the immune system is really complex, and when it goes wrong, it can go wrong in many different ways. You can either have it not enough, too much, or confused. And when it's confused, it attacks itself. There are not very well understood causes, but it is because of a complex interplay, and it's always between the genes and the environment. It's not common, but it's treatable. As with all other illnesses, right? A moderate, clean living lifestyle is your best safeguard. Also, as with everything in life, you have to be aware and beware of quick fixes, because like fast food, quick fixes, there is a price that comes with quick fixes. So this is a picture, a very beautiful picture painted by Pierre-Auguste Renoir, who was a French artist that lived at the turn of last century, that suffered very badly from rheumatoid arthritis. His hands were all horrendously deformed, and he had the misfortune of having rheumatoid arthritis at a time when there was absolutely no medication for it. And it's a testament to his bravery that he is able to produce such beautiful work. Okay, so what I'm going to do now for the next 20 minutes or so is I'm going to look at the Q&A and answer any of the questions that you guys have posted up there. I'm afraid I have to leave on the dot before, at 4:30 or a little bit before, because I have a child that needs picking up across town. So let me just have a little look here and see what's been in the Q&A. Yeah? Okay, just move this. I'm not Dr. Grace from TTSH. Dr. Grace is my very good friend. And some says that mRNA virus causes someone to be less immune to other viruses. No, that is not true. What triggers the cytokine shock syndrome? Nobody really understands it, but it's thought to be one very simplistic way of thinking is that the virus has evaded the immune system long enough such that the load of the virus is very, very high. And therefore, after that, when the body's immune system has caught up with it, it then says, oh no, xiao liao, let's everybody go and attack. And then it then sets up a cascade that is tremendous. And when that cascade is set into motion, it then gathers momentum, and it's harder and harder and harder to rein in. So the only one, I guess the only one way of thinking about it is like a 3-year-old having a tantrum. In the beginning, they go a little bit, and then after that, later on, they are full blown, and there's nothing you can do that to rein it in. It's not the reason why some people suffer weakness or paralysis of lower limbs after a COVID jab. Cytokine shock syndrome comes after infection, after a COVID infection. Is fibromyalgia an autoimmune illness? Fibromyalgia is not very well understood. It's thought to have components that have got to do with dysregulation of how your brain's sensor senses pain. So, for example, it's like saying that in patients with fibromyalgia, the part of the brain that senses pain is malfunctioning. So instead of having a radio that turn on and off, so if for example, I hit you across the arm, you will feel pain, and then the pain would go away. In people with fibromyalgia, I don't have to hit them. I touch them lightly also. They feel the same degree of pain as you would if I hit you. They also feel pain at points of the body where there is natural stress. So the edges of the elbows, the front of the chest, the back of the neck are all points of stress where muscles attach to the skeleton. And in people without fibromyalgia, the brain is able to turn off the signal that comes from there. But in people with fibromyalgia, that part is turned on and turned on extra loud and is playing all the time. So it's like a radio that you cannot turn off. And so it in that way, it becomes difficult to. It's not an easy condition to live with, and it's not an easy condition to treat either. Okay, let me see. Is autoinflammatory different from autoimmune? Yes, autoinflammatory is a malfunction of one particular aspect of the immune system. And it's not common. It's not common at all in adults. The autoinflammatory response is a little bit like saying you have a fire alarm that just keeps triggering on its own. So you have a fire alarm there, and people are supposed to smash the glass in order to trigger it. But for yours, the setting on that is a bit off. And so every little thing, wind blow also, it trigger like that. Okay, so it's a little bit like that. So it keeps on triggering the first responders. That is, in a nutshell, what an autoinflammatory response is like. Is yoga suitable for RA patients? It depends. So if you want to do headstand and you have very advanced RA, I would discourage you because you may have an unstable neck and that may not be suitable. Okay, but if you have, it depends on your the severity of your RA as well as how long you have had it, how well controlled the illness is, and what kind of yoga you intend to do. So if you have RA and you're thinking of going for yoga, I would discuss it with, I would recommend you discuss it with your doctor and also discuss it with the yoga practitioner because certain poses like the plow, the shoulder stand, headstand may not be suitable depending on what kind of RA patient you are. RA skips a generation. No evidence for that. I explained earlier on that RA can affect different people in the family depending on its inheritance is not 100%, meaning that if you have two identical twins that have identical genetic type, only 15% of them have both twins having RA. So if your mother has RA, doesn't mean that you will get RA. Also doesn't mean that the third generation will get RA, not at all. Are there cases where once RA go back into remission? Yes, there are. RA can be different in different people because different people have different genes and different lifestyles and different, we call it RA, but we can only measure one of the RA antibodies, okay, two. Many other antibodies that may be contributing cannot be measured. So, and we are learning more and more about it all the time. There are illnesses that instances where the RA can go into remission and it goes quiet, and then it goes away for a very, very long time. There are also those that have gone away for a very, very long time and then suddenly it comes back. Okay, so we don't understand enough about why it comes back. Sometimes it comes back because of illness. Sometimes it comes back because of stress. They're very, sometimes it just comes back and we never quite figure out why. When doctors can't explain causes of some some symptoms, they often end up saying it's autoimmune illness. Well, I hope they don't do that. Yeah, for most of there are illnesses that are known to be autoimmune. There are illnesses that are suspected to or were suspected to be immune related previously, but not proven. Sometimes doctors are unable to diagnose or explain the causes of some symptoms because we are limited by the tests that we have. So one good example of this is the condition fibromyalgia that I alluded to earlier on, which was one of the questions asked by one of you about whether fibromyalgia is autoimmune. So a patient with fibromyalgia feels pain at certain particular areas, areas of greatest pressure at the sides of the elbows and different parts of the skeleton. They also feel extremely exhausted and extremely tired all the time, but the blood tests are all normal, as are the x-rays. So for a very, very, very long time, patients with this condition were very frustrated, and they felt that they were being told that they were like, you're crazy lah, yeah, because I can't explain your symptoms and therefore you're crazy. But actually, there has been a very elegant set of studies done where functional MRI of the brain of such patients was done, and that's how it was found that the part of the brain that senses pain in these patients are working well over time. And once that was shown, it then became understood why in such patients, they will take conventional painkillers and it doesn't work for them because the problem is not out here. They are feeling that problem is out here, but actually the problem is in here, in that particular part that is sensing it. So yes, there are illnesses that are being diagnosed all the time. COVID is one example, and we are learning new things about it all the time. And so, there are also autoimmune illnesses that we are that previously we couldn't characterize, but now with the improvement in biochemistry and biomedical science, we are able to test for more and more things, and so profile illnesses, and especially autoimmune illnesses, better and better and better. Okay. Treatment for psoriatic arthritis, I haven't really touched on it here. That is a whole separate topic on its own. The websites that I sent earlier on, versusarthritis.org, you can go and have a little look on there. It gives you very, very interesting information about other things like fibromyalgia, like psoriatic arthritis, and a whole lot of different rheumatology conditions as well. So it's www.versusarthritis.org. That gets you to a British charity that used to be called Arthritis Research UK. It's now called Versus Arthritis, and it has got a lot of information leaflets on all the conditions that rheumatologists treat, explained in very simple but detailed way on the medicines as well. So it's very, very well worth a look. Okay, somebody's asking here about whether patients with autoimmune illnesses, whether it's safe for them to take mRNA vaccines. I have encouraged all my patients who are eligible to take the mRNA vaccine unless they have active illness at that time. At the time that I'm seeing them, I may ask them to delay a little bit. I control their illness, then I send them for mRNA vaccination. The reason for that is because, yes, of course, there is a flare every time, not just mRNA vaccine, any vaccine, okay? Even the killed vaccines, like Sinovac and Sinopharm, because in order for you to develop antibodies, you must stimulate the immune system. Every time you stimulate the immune system, don't care whether it's mRNA vaccine or killed vaccine like Sinovac, Sinopharm, or you caught COVID itself. all of those three things, or not even COVID, you catch diarrhea, you catch flu, you catch whatever illness, also this illness can trigger anything that causes your immune system to rise, will and could potentially be a trigger that triggers a relapse or triggers some other autoimmune illnesses to take place. However, so with everything, it's got to be risk versus benefit. I have seen patients who have been who have had COVID themselves, whose immune illnesses have gone completely haywire afterwards. I've also seen patients who have had COVID who have done very badly, and a couple of my patients have died who have not been vaccinated. So I would say that any vaccine is better than no vaccine at all if your doctor says it's okay for you to have it. Okay, there are subcategories of people who cannot have it. We do not have the time to discuss it here, but I would say that if you are at all unsure, go and see the doctor that treats your condition and ask them to do have a frank discussion with them about this